I'm John Bachman. Welcome to Newsmax Health. Right now we're talking about what tests you should get when you go for your routine checkup with your doctor. Also, what else you should talk about. Research shows that much of the screening done during routine physical exams, for example, PSA tests and mammograms, for example, often do more harm than good. Dr. Jacob Teitelbaum, author of the best-selling book From Fatigue to Fantastic, says it's time to reassess the checkup. Dr. Teitelbaum, thanks for being with us today.
John, great to be with you.
Well, you say instead of getting a checkup, people should get a tune-up like a car gets tuned up. What exactly do you mean by that?
Absolutely, because most people never feel better for having had a checkup. They may be relieved that they don't have it yet, this cancer or other dread disease, but they don't do anything to tune up how they feel. And we're going to go through, think of it as a 10-part oil change today that will leave you feeling outstanding.
And so when we go in for a routine physical, what are the tests and what things should we talk about with our doctor? What's most important?
Well, here are the key areas, and it's not so much tests, it's how you're feeling. So for example, sleep. Are you able to be getting at least 7 and preferably 8 hours of sleep a night? Do you wake up refreshed? If you're waking up exhausted, you want to look for things like sleep apnea or restless leg syndrome that cause poorly restorative sleep. Or if you're not able to get more than 7 hours sleep a night, you want to do some herbals. There's mixes like the Revitalizing Sleep Formula, some melatonin, even the smell of lavender that can leave most people sleeping like puppies. That one simple area will leave people feeling dramatically better. And that's just the first out of 10.
Well, are there any key tests specifically that we should maybe avoid, even if our doctor recommends them?
Oh, God. A lot of things. Basically, you want to ask the doctor, what's going to happen? What's the risk if I don't do this? The tests that I do recommend will be having thyroid testing done every few years, realizing that most people who need thyroid hormone have normal blood tests, so you go by symptoms. Blood pressure and maybe a diabetes screen with blood sugar each year is a good idea, but soon you'll be able to do that at your local grocery store. Also, the colonoscopy testing every 10 years. It's a pain in the bottom, but it's one of the few screening tests that's really worthwhile doing.
How about at the dentist's office? These dental x-rays are often given to a lot of patients every year. Is the radiation harmful? We have to wear those lead vests sometimes. Do we really need not only the x-rays, but do we need those lead vests?
Oh, I think the radiation is modest, and I don't personally believe that you need it yearly. I think it's very effective at having to raise income for your dentist, but I don't think it does much for people. I think having a good diet without excess sweets, making sure you get plenty of vitamin C in your diet, those things are more important. But beyond that, I don't even think a yearly dental exam. I think every several years. And if you go in, I don't think
So what's your recommendation here? How often does a healthy middle-aged person really need a physical exam?
Well, I think if people are going in every 3 years for a general checkup, that's probably optimal. Now, there are different ages. If you're 50 to 60, you may want to go in every 2 years. But I think every 3 years or so, get your eye pressure checked, check your blood pressure and blood sugar yearly. Again, you can do that at the local pharmacy. Pretty soon the sugars will be available. I check a cholesterol test every 2-3 years and a blood count. I do not recommend treating cholesterol blood tests with medication. They do not decrease risk of heart disease significantly. Eating chocolate is 3 to 10 times more likely to prevent getting a heart attack than taking cholesterol medicines if you don't have a history of heart disease. But I check the cholesterol because if it's low, it tells me to consider low thyroid and in men, low testosterone. And testosterone and thyroid levels, those are really valuable to check and to treat as appropriate.
So it's key to listen to your body more so than what some of the quote-unquote experts might tell you.
Absolutely, John. And I mean, I tend to go to the doctor if I feel bad and I have a problem that needs it. Otherwise, I'm going to look at my sleep. I'm going to look at my thyroid and testosterone levels. I'm going to go ahead and see, are there infections going on? Do I have pain and signs of inflammation? If people have arthritis or other kind of pains, anti-inflammatory herbs like curcumin, willow bark, boswellia can be helpful. Products like Curamin or N-Pain are two of my favorites. Getting nutritional support, a good vitamin powder, like the energy revitalization system, is going to optimize energy. Research study we just did showed another nutrient called ribose increased energy 61% in 3 weeks on average. So there's all these little things, and for God's sake, go outside, get sunshine. The advice to avoid sunshine probably causes tens of thousands of deaths a year.
Dr. Jacob Teitelbaum, thanks for being with us today.
John, a pleasure.